Welcome to our podcast, JACC Edge ESC Recap. This is your host, Pratik Doshi. I currently serve as the editor of the JACC Edge monthly newsletter, where we do a deep dive in hot topics in cardiology. We are lucky to be joined by Dr. Dipti Itchhaporia, the past president of the ACC, a current clinical professor at the University of California, Irvine, the director of disease management at the Hoag Heart and Vascular Institute, and a current board member of the World Heart Federation. Dr. Itchhaporia, thank you so much for joining us today. I'm really excited to have you today.
Thank you, Pratik, so much for inviting me. It's such a pleasure to be here, particularly to talk about something that I really enjoy talking. I like to always talk about some of the trials coming out of any sort of scientific session. So I'm looking forward to spending some time with you. You know how much I enjoy traveling, so I enjoyed being in Amsterdam, and actually on my way back, I even stopped off in Brussels and enjoyed some of the cuisine in Brussels too. So you want to get right to it?
Yeah. So before we do, I would love, for our audience who may not be as familiar with you, if you don't mind sharing a little bit about yourself, maybe a one-liner about things you enjoy even outside of medicine.
Well, I just said I love to travel, so that's one thing. I'm a foodie, so that's one thing. So one of the things that I love when I do travel is to find, the unique cuisines and really great restaurants. So that's one of my passions is food and travel.
Well, if any of our listeners have any food suggestions for either yourself or me, I haven't been to Brussels yet, or Amsterdam. So if anyone has any suggestions, I'm very open to it. But
yeah, I know. It's always good to hear from all our colleagues, right? Because people have been everywhere, and it's always nice to get some suggestions.
Absolutely. For next year's 2024 ESC.
Yeah, which is going to be in London, by the way.
Perfect. I hear they have fantastic cuisine. But to really get into the meat of our topic today, I would love to hear about your experience in Amsterdam and ESC Congress and about all the latest learnings from this conference that we can apply to clinical practice.
Yeah, this was a great meeting. First of all, it just sort of, post-COVID, we continue to show how much we enjoy live meetings. So again, you could feel the buzz. Everybody was there. In spite of the fact that the COVID rates are increasing, people were hugging and just wanting to be there and very excited to be there to hear all the different content. I think there were a lot of exciting things that were presented. But, when I think about practice changing research that was presented, I would have to say, the hotline program kicked off with the STEP HF preserved EF trial. And this was the first trial of pharmacologic agent to specifically target obesity as a treatment strategy for heart failure. And I think that's in those patients with preserved ejection fraction. So first of all, I think that we don't have that many things in our toolbox for preserved ejection fraction. I think that the idea that obesity is involved with patients with heart failure, that's something that we've known. So this trial really was exciting from the standpoint that we can say now we have a new tool in the toolbox, a GLP-1. Not just the SGLT2s, but the GLP-1, because this study showed that these patients had a greater weight loss, 13% weight loss. They improved their functional capacity, their symptomatology. They had a reduction in their CRP, the NT-proBNP was lower. So I think, and that weight loss was quite impressive. So I think this is an exciting trial because it opens up a whole, arena of new drugs now that we can use in this. And then also the idea that we really need to target obesity if we're going to, target some of these patients in terms of their long-term outcomes.
Yeah. What's really exciting about this? So I was a public health major in college, and to really see the integration of, clinical medicine at the forefront of where I believe clinical medicine is headed, really back, and I would say to its base of like, how do we think about disease on the long term? How do we care for people who have these these chronic conditions and develop good therapeutics? It's to see both of those worlds really coming together.
Right.
And so 13% weight loss is massive, in some of these patients.
Well, and that was the thing. It was safe. The weight loss was impressive. And then to just see their symptoms improve, their functional capacity improve. I obviously this is a starting point. There are a lot of questions that were unanswered. what happens to these patients in terms of atrial fibrillation. If you're an electrophysiologist, you may be interested in that. I mean, I think there's still questions to be answered, but this just opens up that field for us to really, foray into. So I think more to come on this, but I think that was something that we're going to be talking about for a while.
Absolutely, absolutely. And I'm really excited to see how we advance things for patients everywhere, and also, in terms of our research and our community overall. So one of the other trials that I really wanted to talk about was, ESC serves as this major global cardiovascular conference where everyone really comes together. And there's this discussion about how heart failure outcomes with use of SGLT2 is actually relatively similar despite racial or geographic differences. And there's this new focus on developing a global GDMT implementation strategy. So not so much just focused on, different ethnic groups or different racial groups, but really one solution that we can apply to almost the entire world's population that has heart failure. So when you hear about studies like this, how does that change how you might think about medical management in diverse populations?
Well, I mean, I think that the study that you're referring to, I think those studies are really instrumental, kind of in advancing our understanding of how medical interventions perform in diverse populations. I think they emphasize the importance of evidence-based medicine that transcends geographical boundaries, right? Ultimately improving patient outcome and reducing healthcare disparity. Look, heart failure is a global problem. So the idea that we can have a therapy that you can use no matter where you are in the world, I think is very appealing. So, I mean, I think this study was really important. We know that based on geography, there can be different patient characteristics, and treatment and outcomes sometimes vary considerably by geographic regions. But I think the safety and efficacy of the SGLT2 was consistent across the regions. And I think and it wasn't modified by geographic locations. So I think this is a study that's important because it makes us think globally, which is certainly helpful when we think about promoting equity in healthcare. I think in reducing healthcare disparities. I think it makes us think about global treatment guidelines. The idea that we can have outcomes everywhere that are equal makes us think about underserved population and how those patients should also be targeted. And ultimately that improves patient outcomes. And then, of course, you can use data like this for healthcare policy, right? When you go to particularly low and middle income countries where we're seeing a rise in cardiovascular disease, we can utilize data like this to say, hey, although these drugs are expensive, you need to be, treating these patients. And then, of course, research priorities, all of those things are important. So I think this is a very important trial from that standpoint.
Yeah, absolutely. The other way I like to think about these types of studies is almost like ammunition. As clinicians, it provides us ammunition to talk to our patients, but it also gives us a base to provide our policymakers, both regionally and internationally, to advocate for better drug prices and better use of appropriate medications for common conditions. And heart failure with, a globally aging population is really important as one of those disease modalities that we really want to have a global strategy for.
Right.
Yeah. And the other part I think that is like really exciting about this is it really does show the impact that a conference like ESC or even ACC that's upcoming really has on our global understanding of how are we supposed to approach disease management. And so it's really cool to see people coming together in this way.
Right. I mean, well, think about it, the guidelines, right? ESC, ACC guidelines. I mean, they're used worldwide. So we really do have to think about all areas of the world when we're sort of putting together this. And we have to sort of take into account any of the geographic variation. So I think we need to think in this direction. So I think it's really important. Studies like this really make us think about that and say we need to target this.
Absolutely. Well, one of the other studies that hit a little bit closer to home for me, being a person of South Asian descent, is there was a recent study at ESC that actually did demonstrate some level of genetic differences and how that actually impacts care. For example, the study done in the UK showed how people or certain people of South Asian descent are more likely to have variable or low efficacy of clopidogrel metabolism as compared to other ethnicities or other racial groups. So how do then genetic and population studies play into our understanding of creating precision therapies for patients as compared to
Yeah,
global?
no, I think that, well, I think this trial was important because of that idea of precision-based, um, therapy. I mean, we need the genetic information to target therapy that's good for individuals, right? And I think by matching the right drug to the patient's genetic makeup, we can provide then therapeutic benefits while minimizing the side effects or therapeutic failures. And so we need so studies like this are important. And I think what it's highlighting is that it's not only precision medicine, but pharmacogenetic driven approaches are what we need to do nowadays.
Yeah, I think that that's probably the big term, that pharmacogenetics still play a very, very critical component. And I think
Right.
it serves both purposes, where if you find no difference, then it allows you to develop global strategies that you can apply everywhere. And if you find differences, then you can then, go in that direction and say, we actually need to look in these populations and see if there's better medications available, which I think this study is at least demonstrating for certain people of South Asian descent.
Yeah, and I think that ultimately we prevent those adverse outcomes. So when patients, maybe part of the adherence problem is that people are afraid of the side effects. But if you can say, look, this has been tested in somebody with your genetic makeup, and we know this is effective and there's no side effects, wow, that's pretty powerful message, don't you think?
Absolutely, absolutely.
Yeah.
And being able to communicate that to patients here and around the world is, I think just increases our ability to treat these diseases.
Right, right.
So one of the other questions I have, and this is more so for myself and my fellow listeners, I'm very early career, still completing my internal medicine residency, but we have a lot of early career cardiologists or fellows in training who would love to learn, how do we approach going to an international or a big national conference? What should our approaches be? What are the things that we should think about?
Well, I'll tell you, going back to when I was a fellow, the one of the things that made me really appreciate meetings was that we went each year of our fellowship to ACC or AHA. So I went to ACC. I was more clinically bent, so I went to ACC. And so, first of all, I understood what a big meeting like that is. And sometimes that can feel overwhelming. But I think if you take some time and look at the agenda and say, these are the things that interest me, and try to get a sampling of those things, I think always the late breaking clinical trials is what the buzz is about. So it's important to go in there, be amongst 5,000 of your peers and listen to the discussions. It gives you a deeper understanding of what's going on. I think planning your schedule out that way helps. I think staying organized to say, I need to go from here to there, it's a bit exhausting. But number one, I think you get to hear a lot, learn a lot. Also, you get to meet people. You walk around and you can't believe all the people you run into. And I think that's always helpful, because part of meetings, and the reason people love live meetings, is the opportunities to interact, those hallway conversations that are meaningful. Also, networking. It's a great way to network when you meet people, sit down, exchange information, have a cup of coffee with somebody, have lunch with somebody else, have dinner with somebody else. So it's a perfect opportunity. So I always plan, evenings that I have free with people, try to meet up with people. So I send messages out and make sure that you connect with certain people that you want to. Sometimes it's hard when you're busy, but I think that's important. I think also when you go to sessions, don't be afraid, ask questions, be inquisitive, visit the exhibits, learn all of the new things. I mean, those exhibits, believe it or not, those vendors spend a lot of time putting out what's new, and they're more than willing to answer questions. It's a great way to learn all the new things that are happening. There's also a lot of workshops at some of these. ACC always has a lot of workshops, and I think it gives you a hands-on experience going to those workshops. And then overall, you just want to stay informed as to what's happening. It's a
Mhm.
great way, if you are a researcher, to be able to set up collaboration with other researchers that may have the similar interest. I think it's important to go to the poster so you know what people are doing out there, because sometimes you may have an idea and you think, oh, I don't know about this idea, but then you get to see what everybody else has put out there, right? So then I think, and I think lastly, just enjoy it. It's a social event ultimately. And these are your peers and your colleagues. When you think about ACC or ESC, this is your community, right, of colleagues. And I go there and I'm very happy just to be amongst my colleagues, doing the things that I want to do and learning together. and having those incredible discussions about all of the things that we just heard or saw or interacted about.
Absolutely. I think I love that point that, it is at the end of the day a social adventure, and it's an opportunity for us to be in the setting where we're learning with our colleagues and enjoying with our colleagues. So I love that. And I think that's a fantastic way to approach this conference and future conferences.
Yep, exactly.
Well, Dr. Itchhaporia, I really, really appreciate your time. It was great learning from you and learning about all the work our European colleagues and colleagues around the world are doing. For more information about the learnings from ESC Congress, as well as other hot topics in cardiology, please subscribe to our JACC Edge newsletter. And for our listeners, this is your host, Pratik Doshi, and we hope to catch you next time on the JACC Edge podcast.
Thank you so much, Pratik.
Thank you.